Are you dealing with pain right above your kneecap? In this video, I'm going to go over 3 different techniques that you can use at home to help to deal with that pain and find instant relief. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor in Helena, Montana, and in this channel we talk about all things that you can do to improve your health. Today we're talking about the knee pain, quadriceps tendonitis or quadriceps tendinosis, which is that pain that you get right above the kneecap. The first strategy that we're going to employ is a self-massage technique that's going to help strip out these muscles, get them relaxed, and get them ultimately functioning better. Straighten out your knee and place one thumb right above your kneecap. Take that tissue and traction it towards your body, followed by reinforcing it with the other thumb. Grip your fingers behind your knee so that you can apply some pressure and slowly bend your knee. As you do that, you're going to feel the muscle, the skin, and the tendons slide under your thumb as it's getting stretched out, and you'll move the thumb again to the middle, traction, reinforce, and slowly bend that knee again, and then move it to the outside and repeat. After you've worked all the way along, move up towards the body about 1 inch and repeat. The quad's a big, deep muscle, so you really got to press hard as you're working through it. After I've made that pass, then I repeat up here, and I keep working all along as far up as I feel like those muscles are tight and tender. At first, this can be tender. Don't push through anything that is sharp pain, or if it feels like it's making your knee worse, give it a break. But you should just feel that good soreness as you're working through an overly tight muscle. The next strategy that we're going to use is going to involve a stainless steel tool. If you're at home, you can use a coin, you can use a butter knife, the back of a butter knife or the handle of a butter knife, and get some coconut oil and start to smear it right around that painful area. And rub that in and just start to scrape that muscle back and forth very gently. At this point, I'm really just warming it up, and you want to switch directions too. Once again, what I'm doing is I'm helping to relax this muscle while also breaking down scar tissue, adhesions, and helping those trigger points to relax. This can be really tender, so if something's hurting too bad, just lighten up or move to a different section of your leg. And you can work right on this tendon right above your kneecap, all around the sides, and then really start working your way all the way up towards the hip. The quads are such big muscles, it can be challenging to get in there and to get deep. So if you have a massage gun, that's something that's going to be really helpful. The one that I'm using right here has a squishy pad for the tip, which still feels strong enough to work the muscles, but if I'm going around any bony edges, like around my kneecap, it actually doesn't hurt at all. It kind of feels good. So you can really get in and around these grooves. You can find these just about anywhere, on Amazon or on eBay, Costco. Just work up and down the muscles, and you can cover a really large area in a very short amount of time. The first time you start doing this, the muscles are probably going to feel tender and your body's going to tell you to stop. You'll have to learn the difference between when you're actually hurting something, but if you're doing this right, you're just going to be targeting these muscles that are sore and overworked and overly tight. As you keep doing this day after day, it's going to turn away from that sharp pain into more of a good pain as you're able to get into that muscle and help it to heal. In more severe cases of quadriceps tendinopathy, something like shockwave therapy can actually be very beneficial. In our office, we utilize the PiezoWave 2, which is a focused shockwave machine. It focuses shockwave into a single point that creates a high pressure zone. You can read more about it on the Mayo Clinic's website. But what we do is I get some gel and I put it around the tissues that we're going to be working on. That helps to conduct the shock waves into the tissues. The shock waves, when I'm going over healthy tissue, as you can hear, each time that clicks, that's a shock wave. Over healthy tissue, I don't really feel anything. Now, I don't have quadriceps tendinopathy right now, but if I did, as soon as I started getting into that area where those tendons were damaged and breaking down, I would feel a very sharp pain. So not only is this a treatment, but it actually helps to focus in and find exactly where the problem is. Once I get onto that spot, I'll hold it from anywhere from 300 to 500 shocks. A lot of times it will start out at about a 7 out of 10, and then as we keep treating the area, the pain intensity is going to go down. Once that does, we move on and we find a different section of the tendon where those fibers are damaged, and we continue to treat that as well. What that does is that helps the body to produce more collagen and remodel those tissues and speed up the healing process. Also, when you have this condition, you can get calcifications in the tendon, and this is one of those things that can help to break that down and really speed up the healing process of that area. If you're dealing with quadriceps tendinopathy, try those different techniques and let me know which one was most effective for you. If you have any questions about our treatments that we do, especially shockwave therapy, please leave it in the comments and I'll do my best to answer that. Please like this video, subscribe to our channel so that we can help you on your quest to feel better, do more, be healthier.